So my name's Elizabeth Guancial. I joined Florida Cancer in 2018. I had done my fellowship training at Dana-Farber in Boston, and after that served at University of Rochester for 6.5 years. Eventually it was time to move on, and we decided to move to a different geographic area. After I had selected Sarasota, I realized many of my patients actually were snowbirds, and this was the exact area where they would travel to on vacation. So early on, it was really a nice continuity for me as well as for them, because some of my patients from New York actually, I started caring for them down in Florida also, so that was really nice. My focus, probably a third of my patients are genitourinary, and then another third are women's cancers, cervical, uterine, vaginal cancers, gynecologic. And we have wonderful multidisciplinary tumor boards. So as a medical oncologist, I can't do what I do without my surgical colleagues and radiation oncology also. So every week we have an alternating meeting between the genitourinary component or the gynecologic. And all the specialties are there. Myself for medical oncology, radiation oncology, gyn-onc or urology, along with pathology and radiology. So it really, I think, delivers multidisciplinary care for our patients since we're not all in the same building. Sometimes people get the impression that their care might be fragmented or we're not working together on the treatment plan. It's absolutely not true. I mean, we really work together very closely. Similar to a lot of people in oncology, personal experiences really, call us to that field. So I had a number of family members who had been through cancer diagnoses and treatment. And then the more advanced I got in my schooling, I realized it was a wonderful career where you not only get to interact with people every day, which I love, but there's a huge amount of science behind it as well. I think our field in particular, the pace is ridiculous. I mean, literally standard of care can change in 6 months. And to be a part of the research is really exciting because then you get to see these things evolve over time. It's a total honor, to have patients trust you over time, to be able to win that trust. It can be emotional, it can be heavy at times, especially when things are not going well. But so often, the most gratifying visits are a few years down the road when you turn around and look at everything that you've been through with that patient and things went well. There can be a lot of ups and downs along the way. Cancer treatment is complicated, and there can be unexpected complications that come up. So I think the sooner we can earn someone's trust, the easier it makes it for everyone, because that level of anxiety, am I doing the right thing? Can I trust this team of physicians? Once that settles down and people do feel like they trust us, it makes everything a lot easier. That way they know whatever unexpected thing might be around the corner, my team has my back. That's really gratifying.